Hello. So today's topic is going to be on should you be worried about throat cancer? So I frequently see people coming into my office and they don't even always say it out loud, but usually with a little bit of digging and questions, I kind of find out that it's something they're very worried about. So I find frequently I'm actually a big part of my job is kind of reassuring people that they don't have anything terribly wrong with them. So that's very rewarding for me. Um, but people do frequently come in and they have a lot of concerns about this. So I'd like to educate you guys a little bit today about what the typical symptoms of throat cancer are and other common symptoms that people a lot of times worry about it, but it's not actually usually associated with throat cancer. And then I'll also give you a little idea of what are typical risk factors that would make someone at a higher risk of developing throat cancer. So, first of all, what are the typical symptoms we see in someone who is diagnosed with throat cancer? So, there's kind of a few things, and I'd say the most important one is pain in the throat, and sometimes pain in the ear as well, which can be referred from the throat. And usually, the story is the pain started off mild, and then it's kind of gradually gotten worse over a few weeks or a few months. The second symptom we typically hear is difficulty swallowing. And again, the story is it's kind of started not so bad and then it's gotten progressively worse over time. Third, we commonly hear people complaining of voice problems, so hoarseness, and like the others, it starts out mild and then gets worse over time. And then finally, a common initial symptom would be feeling a lump in the neck. And this is usually out on the side of the neck, like out here or over here, sometimes up under the jawbone as well. So those are kind of symptoms that may be worrisome for throat cancer. Now, a lot of benign conditions and things that are not serious can also cause those symptoms. So I don't want anybody freaking out just because they have a sore throat. It does not necessarily mean there's a problem. So other symptoms that I hear frequently that worry people a lot, but are not typically main symptoms of cancer, are things like feeling like something's caught in their throat, or there's a lump sitting in their throat. Our medical name for this symptom is called globus sensation, and while it potentially could be, it's pretty unlikely that would be the only symptom of cancer in the throat. Another common thing that people worry about would be coughing. Coughing is certainly a nuisance, but it's usually not something that's caused by throat cancer in particular. These are kind of common things that I see, and it can help to reassure people. So the best way to find out for sure what's going on would be to come in to see a specialist like me. I have special equipment where I can kind of see down in your throat, and we can make sure, nothing's going on, or to diagnose if something is going on. So the last thing I would like to talk about is people, groups of people who are more likely to have this sort of problem. So the biggest one would be people who smoke. So smoking traditionally has been the number one risk factor by far for developing any kind of cancer in the throat. It's certainly still number one or maybe number two on the list. In the past 10 years or so, there's been a new group of people who are also, somewhat likely to do this or to develop cancer even if they don't smoke. And these are people who have infection with the HPV virus. So HPV stands for human papillomavirus. It's the same virus that causes warts on your skin, or it can also be in your mouth or your throat. There are certain strains of this virus that make people much more likely to develop cancers in the back of their mouth, their throat, and then also in other areas of the body as well. So that's a very good reason for people to consider having their kids or even young adults vaccinated against the HPV virus. It can prevent cancer in the future. So anyway, if it's something you're concerned about, come in and see me. I can certainly look in your throat. We can evaluate you. And the vast majority of people, they don't have cancer. So it's very reassuring to set people's minds at ease and to help them sleep a little bit better at night. So everyone have a nice day, and we'll talk to you soon.